Do you frequently feel like your heart aches sometimes? Or maybe you've noticed a strange lump in your neck, under your arm, or in your belly that just won't go away. It might not be just a minor issue. These could be warning signs of something more serious, like a type of blood cancer called Diffuse Large B-cell Lymphoma, or DLBCL for short. Imagine your body is like a big city, and your immune system is the police force. In this case, the police officers, called B cells, start acting crazy and multiplying too fast without control. Instead of protecting you, they begin causing harm. DLBCL is the most common type of non-Hodgkin lymphoma. That means it's a cancer that starts in the lymphatic system, which helps fight infections. And the scary part, it grows fast. But the good news is that it can often be treated if found early. What makes these B cells go wild? Well, scientists don't know the exact trigger, but think of it like a software bug in a robot. The DNA inside a normal B cell gets small mistakes or mutations, like typos in a recipe, and suddenly the cell doesn't follow the rules anymore. It keeps dividing nonstop and refuses to die when it should. Now, who's to blame? It's not like catching a cold from someone. You can't get DLBCL from shaking hands or sharing food. But some things might increase the risk. For example, are you over 60? That's a higher risk group. Ever had another immune disease like lupus or HIV? That's like having a weak security system. It gives the bad cells a better chance to grow. Some infections, like the Epstein-Barr virus, the one that gives you mono, can also nudge the cells in the wrong direction. But remember, having a risk factor doesn't mean you'll get it. Just like living near the beach doesn't guarantee you'll get sunburned, but it raises the chance. So, how do you know if something is wrong? Let us play detective. Have you felt unusually tired lately, even after a good night's sleep? Maybe you wake up soaked in sweat, not from heat night sweats, we call them. Or perhaps you have lost weight without even trying, say, 10 pounds in a month just like that. These are classic clues. Now press your neck, under your arms, or your groin. Do you feel any painless lumps? If yes, do not panic. Many lumps are harmless, like a clogged pore. But if they stay for weeks and grow, that is a red flag. Some people also feel full quickly when eating. As if their belly is crowded, this can mean swollen lymph nodes in the stomach. Others may have belly pain, fever without a cold, or itchy skin. These signs are not proof of DLBCL, but they are like smoke. They suggest there might be a fire somewhere. If your doctor suspects DLBCL, they won't just guess, they'll investigate. First, they may take a small piece of the swollen lymph node. That's called a biopsy. Think of it like taking a sample of suspicious paint from a wall to test for lead. They'll check under a microscope to see if the B cells are acting abnormally large and spreading out. That's what diffuse large means. They might also scan your body with a PET or CT scan, like a detailed map showing where the bad neighborhoods of cells are. Blood tests can help too. Once confirmed, treatment usually starts fast. The most common plan is a mix of medicines called chemotherapy, the R-CHOP combo, a name like a rock band, rituximab, cyclophosphamide, doxorubicin, vincristine, and prednisone. It's strong, like a powerful cleaning crew sent to remove the rogue cells. Some people may also get radiation, or, in serious cases, a stem cell transplant, replacing the broken system with a new one. Most patients respond well, especially when caught early. Nearly 60 to 70% are cured. Can you stop DLBCL before it starts? Sadly, there's no vaccine or simple pill to prevent it, since we don't fully understand all the causes. But you can boost your body's overall defenses. Think of it like maintaining your car to avoid breakdowns. Don't smoke, it damages DNA. Eat healthy, stay active, and keep your immune system strong. Handle infections early. If you have HIV or hepatitis, proper treatment lowers lymphoma risk. Avoid long-term exposure to certain chemicals, like pesticides or benzene, found in some plastics and fuels. And most importantly, listen to your body. That weird symptom you've been ignoring, get it checked. Prevention isn't just about avoiding causes. It's about catching problems early when they're easier to fix. Science never stops. Right now, researchers are like tech developers upgrading the apps that fight cancer. One exciting area is targeted therapy. Instead of bombing all fast-growing cells like chemo, does these new drugs aim exactly at the broken parts inside lymphoma cells? For example, drugs like polatuzumab target a special protein on bad B cells like a key that only fits a specific lock. Another breakthrough is CAR T-cell therapy. Scientists take your own immune cells, supercharge them in a lab to hunt cancer, then put them back like turning your bodyguards into superheroes. Recently, new combinations of immunotherapy are showing better results even for patients who didn't respond to chemo. Clinical trials are ongoing, meaning patients can volunteer for cutting-edge treatments. The future, more personalized medicine treating each person based on their cancer's unique DNA, not just one size fits all. It's a hopeful time for DLBCL patients.